Hi, I'm Dr. David Hill, and today we're going to talk about how to lower cholesterol levels in children. Now, the first question is, why would we want to lower a child's cholesterol level? Well, there are a few conditions in which we may want to check a child's cholesterol level. If the child is obese, for example, if the child has a strong family history of very high cholesterol levels in close relatives, if the child has another condition like diabetes that may be impacted by cholesterol levels or may cause higher cholesterol levels, or if the child is on a medication, some of the newer antipsychotic medications, for example, can affect cholesterol levels, your doctor may well want to monitor those cholesterol levels. There's actually a protocol to start monitoring them at age 10 in children who have one or more risk factors for high cholesterol. That said, so you get back the labs, what are you going to do now that you know the cholesterol is high? Well, the basics still apply. Diet and exercise are the things that are the very most in your control. You want to look for a diet that's high in fruits, high in vegetables, low in saturated fats. You really want to stay away from the trans fats, the snack foods, the fast foods. You know all this stuff. It's out there in the ether. You know what your child shouldn't be eating. Likewise, exercise is really important. Turn the TV off if it's on. 30 minutes a day, an hour a day, maybe, but the less the better. Certainly no more than 2 hours a day. Anything the child is doing other than sitting in front of the television is likely to be better for cholesterol levels than sitting in front of the television. Now, even when diet and exercise are working as well as they can, some children's cholesterol levels are not going to fall enough. When and whom to prescribe medications for is an area of some controversy in pediatrics because we don't have a whole lot of long-term data. We don't know what these medicines are going to do 50 years out. But we do know that heart disease, the sort of disease that causes high blood pressure, strokes, kidney failure, does start in childhood. And we have every reason to believe that a dangerously high level of cholesterol in childhood will contribute to earlier development of exactly these diseases. So if your doctor wants to send the child to an endocrinologist or wants to explore the possibility of medicating very high cholesterol, as distressing as it is to think about putting a child on cholesterol medicines, remember that cholesterol is going to be building itself up inside the arteries for the rest of the child's life. And it's quite likely that bringing it down at this point may buy that child a longer, healthier life in the future. That's something to discuss with your child's doctor. So talking about how to bring down a child's cholesterol, I'm Dr. David Hill.